I'm not surprised when patients say to me, "How can I have tennis elbow when I don't play tennis?" The name is a hangover from when it was first described in the 1880s, where patients were playing tennis with heavy wooden rackets and catgut strings. And this heavy weight, particularly in a backhand and a repetitive activity, was causing pain around the outside of the elbow. This pain can be reproduced by any repetitive lifting activity, and it is something that we commonly see in people's 40s and 50s, a time when generally the skeleton loses the ability to repair and starts to wear. And that's where the problem lies with tennis elbow, or lateral epicondylitis as the more official term. Tendon strands start to break down. This is called mucoid degeneration. It doesn't mean the tendon's falling apart. It just means that some of the collagen fibers are just not up to the task being given to it at this stage in life. We see this scenario in other tendons in the body. We see it in the shoulder, where we call it rotator cuff impingement. And we can also see it in the back of the ankle, Achilles tendonitis, or around the knee as patellar tendonitis. It's not a disease, and it doesn't mean that joints aren't going to work. It just means that they're going through an aging process. There's no inflammation as part of this aging, and that's why anti-inflammatories such as Nurofen or Voltarol or steroid injections may not give lasting benefit. In fact, most studies have shown that the best treatment for tennis elbow is to let it burn out by itself, and this will take place over a course of a couple of years. This might be frustrating, but it's good to know that it is a self-limiting condition. There are things we have tried to help it along. Mostly, we'll start with making sure the diagnosis is correct, and that's with an MRI scan. We can see there any degeneration within the tendon insertion. If there's a big tear in the tendon, by which I mean a number of collagen fibers have broken down, then there might be a role for surgery, and that would be to reattach the tendon. We are also using a relatively experimental technique using platelet-rich plasma. We take blood from you, spin it in a centrifuge, and use the good stuff, the gold layer at the top that has the healing factors and the platelets that we normally have, but in a concentrated form. And putting that directly into the sore spot in the tendon has shown a roughly 80% improvement in patients' feelings of pain. It may not solve the problem, but it may make things more manageable. Physiotherapy is also really helpful in helping to understand and re-educate the muscle on loading that tendon. So there are a number of techniques that may be helpful in addition to sitting it out. I often tell my patients there are no old people with tennis elbow, so I do see it burning out, and that's reassuring to know.